As physicians, one of the first things that we have to do is understand our value, right?
Yes.
There's a shortage of us, and it's
Yes.
only getting worse. So, one of the things that I tell young physicians is you have spent all of your academic career trying to prove to people that you deserve to do what you're finishing your training doing.
Correct.
You have to change your mindset now. Your mindset has to be, I have finished my training. I have enormous value. And I don't just have to go and be an employee in a big hospital system and just be a number or a
Mhm.
cog in the system. I have enormous value and I now have enough training. I can do what I want to do.
Exactly. I love it.
That's what I tell them because I think too many of us start to recognize that 7 to 10 years into practice, like what Herb was saying, right? After 7 to 10 years, they're burned out because they've done more than they were capable emotionally, physically, based on what their demands were, based on what their life goals are. And so then they see it just as I either do it this way or I don't do it at all. And I would much rather keep those physicians in the system doing what they love doing because they'll do a better job, they'll stay in the system longer, and we won't lose them. And
Mhm.
then we have to figure out how to use all these advanced practice practitioners to do the stuff that we don't have enough physicians to do.
Correct.
But we have to put our physicians in their most valuable roles because we don't have enough of them.
Yeah, I
And in
agree with you
my
on
view,
that.
that's running the medical team, that's running the medical home. I think it should be running the medical practices. I think it should be overseeing the whole thing. But seeing patients between 5 and 8 p.m., like what anybody can do that. It's acute care, it's sick care. I can be on call if they have an issue. Like I don't have to do that. I can do something way more valuable that I have the training and expertise to do.
Yes.
So I'm going to ask you something that you mentioned, which I just love. So in my mind, if we're in an inflection point, we need three things to be done. One, we need to pay physicians well.
Mhm.
We need to limit the number of patients you see a day to no more than 16 in an hour day so that you actually can think and do the other things that you're talking about, care coordination, making sure things are done properly. Sometimes a case, I need to sit down and read about it.
Sure.
And then we need to build up workforce capacity mini fellowships so that more people across the country can replicate what you're doing with
Right.
the asthma care, the obesity care, the mental health care, because this is not being taught in the medical schools and is not being taught in residency. And they've known for the last 20 years that this is a problem.
Mhm.
And
But they
so,
haven't changed. You'll also, what I find with all
so,
these
so I want to
things,
know how you get to seeing only 16 patients a day, taking a good salary and keeping the doors open.
you can't.
That's what we do in our office.
That's
Now,
why,
we don't
yeah,
limit the number of patients to a certain number per day, but we schedule appointments based on how long the chief complaint or we think the patient is going to take. And a lot of our APs that are doing mostly acute care, especially in the wintertime, they see patients every 15 minutes. But my schedule, some of the appointments are 45 minutes, some of them are 30, some of them are 15. And so we schedule based on what the concern is and give ourselves the amount of time that we need to see the patient. I would say it's probably closer to 18 to 20 for a full-time pediatrician. Some of our physicians use scribes, and that has made a huge difference. I'm very hopeful that AI will do a good enough job to be able to do as much as my scribe does for me now.
I can tell you for a fact that
Yeah.
it does.
The one thing my scribe does a ton for me right now that the AI still isn't doing is all kind of the order entry,
Yes, you're correct on that.
adding problems to the problem list. So when I'm talking to my scribe, I'm like, add this to the problem list, pop in the order for the MDI treatment, do the
Yeah.
order for and I'm talking to them while I'm looking something up on Up to Date or
Mhm.
looking up a dose of something, show them the growth curve and talk about the growth curve, and I'll look up stuff on their past history and then putting in prescriptions. And she orders my vaccines. I watch her do it, but she does all of that.
No,
yeah,
AI scribes are very good. My biggest problem was the story taking, the
Yeah.
HPI, and the plan.
Mhm.
The scribe that I use really helps
Does
with
a good
that.
job. And so I think we're getting there with
Yeah,
that.
it's getting there.
eventually it's going to be able to do all of it.
Hopefully.
Because it won't be long.
Now,
So,
So
so
I
both
see
are-
that as
she has
we're
a
getting off
perfect
topic.
practice.
No, no, we're
That
not.
was a lot. Yeah.
We're coming there, George.